Quick note before we start. This content is for educational purposes only. We are not promoting the use or purchase of any substances. Our goal is to explain science, regulation, and history. Always follow the laws in your country and consult licensed professionals for any health related questions.
So, welcome everybody. Welcome to Eywa. This is Eywa Academy. We're exploring the psychedelics, not only therapeutics tool, but as a part of the broader transformation. So, we're here to understand that these tools are able to heal trauma and mental health. So, our work sits at the intersection of science, ethics, and human experience, with the goal of building safe, scalable, and responsible infrastructure for the future of mental health. Today, we are honored to have Marcela Ot'alora. Is Ot'alora? How do you pronounce?
Ot'alora.
Ot'alora. A psychotherapist, researcher, educator, and an artist who has dedicated more than 2 decades to advancing trauma-informed care and MDMA-assisted psychotherapy. Born and raised in Colombia and currently based in Boulder, Colorado, Marcela has played a key role as a principal investigator, therapist, mentor, and lead trainer in phase 1, 2, and 3 clinical trials for MDMA-assisted therapy through organizations such as Multidisciplinary Association for Psychedelic Studies and Lykos Therapeutics. He's also a founding member of the Memorial Center for Visionary Healing Arts, a clinic decided to accessible mental health care, ethics, psychedelic-assisted therapy, and the training for future generation of therapists. Marcela, thank you very much for joining us today, and it's a pleasure to have you here.
Yes, pleasure to be here. Thank you.
Okay, so we have some questions for you. Do you want to introduce yourself, tell something about what you are working now, or we should go directly to the questions that we have?
Well, one of the things that I'm working now in our clinic in Memoru is working with psilocybin. So
Okay.
It's a shift from working with MDMA to now working with psilocybin, which is, plant-based. And so it's a really great privilege that in Colorado, we have the possibility to do that. So we started a few months ago, and doing groups and individual sessions, and also doing trainings.
Great. Okay, I go with the questions. You have spent over 20 years working with trauma and PTSD, both clinically and in research. What first drove you to MDMA-assisted therapy, and what did you recognize in this approach and felt different from conventional trauma treatments?
Yeah. Well, I think what led me to it was my own work with MDMA-assisted therapy for PTSD. And what I discovered, and this was, I was 23, so it was 1984, the year before MDMA got criminalized. And for me, the part that I come back to all the time, even after more than 40 years, is beginning to understand, not even understand, but have a relationship with an essential part of myself that didn't have to do with trauma, that didn't have to do with suffering, that there were other parts and other essences in me to explore. And so it was the beginning of that exploration for me, and it opened my eyes to the possibilities that could be there to cultivate, that could be there, that were there already, and I just didn't know.
When you started working, there was research done, but the year that it became criminalized, many things changed. So, for example, labs that were working with that research, suddenly they couldn't work, or what was the change there?
No, the research started after.
Okay.
The research started after. There's many anecdotal information and books written about using MDMA in therapy before then.
Okay.
Which is what led to do the research, but the research started later.
Okay. Then you often emphasize that MDMA is not a magic cure, but rather a tool within a carefully structured therapeutic process. from your perspective, what's actually happening during an MDMA-assisted therapy session that allows your patient to engage with their trauma and in terms of to material a new way? So do you think, what's your view in here?
Yeah. Well, I think there's two parts. One of them is the MDMA and what it actually does physiologically, right? And
Mhm,
so that it offers, if you think about MDMA as the other therapist in the room, what is
mhm,
it that that therapist, the MDMA, can provide? What are the resources that it has? So it releases serotonin, dopamine, oxytocin, among others, right? And so in this cocktail, in a way, there is a sense of well being, there's a
mhm,
sense of relaxation, there's a sense of bonding. And all those are resources that help an individual address things that in the past maybe had been too difficult to address. So, the other part that it does is that it deactivates part of the amygdala where we store fear. So even though fear is present, is not dominant, and we can kind of see
mhm.
it as something that can be managed and can be worked with, rather than something that that then becomes a resistant, right? That we resist whatever is there because of the fear. So it gives us a window to explore things in a way that feels safer, in
So
a
it's
way.
a way to unlock things that are in our brain that
Um,
without that we couldn't do it, or it's more difficult to unlock them.
it's not necessarily that it's unlocking them. It's more that now your body is resourced in a
Okay.
way that when we think about trauma, we contract, right? We
Mhm,
contract, and there's nothing that can get in, and there's a lot of fear, and there's nothing that can get out. And so if instead what MDMA is doing is expansion, it's
mhm.
expanding us into ourselves in a much more intimate, deeper way, then we have the space to be able to listen to our bodies, to have new perspectives, to bring up memories, to bring up experiences that maybe were too painful and too scary to bring up before. So there is this place of being present with, right? Like our work is generally done is that we're working with what is present, what is there in this moment. And there's also a sense that when we engage with ourselves in this particular way, then we're not judging ourselves so much. Our
Okay.
judge is not front and center. And so we can see things, be guided by a part, well, you can call it a part of us, but I think an experience, be guided by an experience that doesn't have that judge as the first front and center, and also the fear is front and center. So there's more possibility to feel what hasn't actually been felt before.
So it's a way like we have a barrier and the barrier is lifted. So we see ourselves more in a humble way without the prejudice of prejudging ourselves. So it's like, okay, this is what I am, with the good and with the bad.
Yes, in essence, I mean, we do see, I mean, it's not easy. It's not
Of course,
easy
of course,
work.
of course.
It's really difficult. It's really challenging. Sometimes it even challenges our sense of identity, right? Because
Mhm.
we have an idea of what that is, and our identity, even with suffering, right? We can have an identity with suffering. So sometimes it can be a little bit destabilizing. It can be destabilizing because we don't know exactly who we are, and
Of
so
course.
it's an exploration into that. Can we understand now? Um, can we sit in a different place? Can we understand things from a different perspective?
Mhm. Then a central theme in your work, that is the importance of preparation and the integration. Why are these phases just so critical in the dosing session itself? So it's better to be prepared and to be integrated before doing anything. So why these parts are so key for you?
Yes, well, I think in the preparation, we're building relationship. And this
Mhm.
work is about the therapeutic relationship being the most essential piece of it. It's very difficult to be vulnerable with somebody that we can't trust, that we don't feel safe enough with. And, we can't feel fully safe, but if we feel safe enough to share with somebody our vulnerability. And
Mhm.
that takes time and it takes building relationship. And so the preparation is about building that relationship, getting to know who someone is, what is their what are their strengths, what are their desires, what is it that makes them that they suffer about. We like to say, like, what is traumatic about the trauma, meaning what is it on a day-to-day basis that
Mhm.
is the symptoms that affect an individual about the experiences that they've had in the past. So more than the story itself is how has it affected the way they see the world, the way they see themselves, the way they move in their environment. And so if we know that, if we know their strengths, if we know what they believe in, what they're afraid of, what they want in life, then we begin to understand better who they are and begin to develop that relationship individually, not just hear somebody who has PTSD, right? The PTSD symptoms are there, but they're also this individual, complex individual that has so much nuance. What are their resources? How have they survived, right? What is their resilience? And so building that relationship is the preparation, and the important piece in that is building that relationship. And then the integration is is about how are we what is this understanding that happened, or this experience that happened with MDMA or psilocybin,
Mhm.
for instance, or ketamine. Um, what is it how is it that we can begin to integrate it into our system, into our
Okay.
body, right? So without it, it can just be an experience that then doesn't change anything in our lives. But it starts with awareness, because we can't change anything that we're not aware of. So what is it that we became aware of? And
Uh-huh.
how does that awareness change the way we see things? And so beginning with that awareness, and these three, like we say, like three states, and they don't necessarily come one after the other. They can be
Okay.
intermingled, and one of them can come before the other. But another state is, then how do we make meaning of this awareness, right? Or meaning of the experience? How do we make meaning of what we felt, right? The felt sense of the experience. And then how do we bring it out into the world? What
Very interesting.
what is it that we want to now present to the world, to present to our loved ones, present to our environment, present to ourselves, right? And that is where the change begins to happen, that we are now seeing the world from a different perspective, and that's going to take time to integrate so that then we show up in a different way.
I like what you mentioned before about the preparation, because it's like understanding that there's a context, not just to the PTSD, but for the person. So the person that is helping needs to understand not just the picture, but the full movie. So everything that comes before the actual moment and what comes after. So I like that expression, that you need to prepare for that, to understand everything. It's not just the case this person today is okay. What led to him here or her to
Yeah.
here, and what is after? Because maybe if a person is not able to recover, or is trying to recover but doesn't have a safe place or a context where he can improve a little bit each day, that's very, very important.
Yeah.
Okay, then much of your teaching highlights the role of therapist as someone who holds space rather than directs the experience. What skill, attitudes, or inner capabilities do you believe are essential for therapists working with psychedelic assisted modalities? So what's the key from your point of view?
Yeah. For the therapist.
Yes, the therapist. Sorry,
Yeah.
it was very long.
I think one would be that we come with more questions than answers.
Oh, good.
And so that we are not the expert in the room, and that our questions are really guided by not knowing, that we really don't actually know the answer. It's not that we're asking a question because we want to reassure that the answer that we have is the answer that they're going to tell us. It's more that I actually have curiosity and don't know the answer to the question I'm asking. So can we approach the sessions with curiosity about the person in front of us, rather than we know the answer, we are the expert, we are the ones um that know best, right? There's a saying in Gestalt therapy that says guiding from behind.
Uh-huh.
So that we're guiding, but we're behind them, and they're the ones that are actually showing us their wisdom, that their recovery, that they have everything that they need in order for their recovery. So they are showing us the way to their own recovery. So it's sort of like not being in a hierarchy, and beginning to level that, and beginning to say, like, I'm actually the witness here, and I'm learning and being guided by the participant, being invited to share, to witness their process, and they're the ones guiding me to their own recovery. So I think that's one that's really essential. Um, I think humility is another one, that, of all those things that I just said, that we're humble in the sense that I actually am okay with not knowing.
Mm-hmm.
It's really difficult sometimes for therapists to not know, because we are taught that we have the answer and that we know and that we can help in this particular ways. But
You don't always have the answer.
yes. And so I like when I teach this work, I always tell my students, I said, imagine if there's four things that you're not there to do. That you're not there to fix anything, you're not there to solve it, you're not there to assume or to interpret. Then what do you do if you don't do those four things? Right? So what that creates is sort of like uh, what is sintonia?
Ooh, I would say rhythm. No, it's like the
Attunement, right? That,
attunement.
yeah, I think in some ways that we begin to attune to what's actually authentically there without agendas, and in the and I think it seems like, I know I've done this so many times, like when we don't know something in the moment, then we resort to what we know, and when we resort to what we know, we often miss that opportunity to actually know what's happening in the moment, what is really going on for them. So if we can really sit with not knowing,
Mm-hmm.
then we don't miss the nuances of um, what they're experiencing in the moment, instead of taking them out of that experience because we're asking them things to guide them in a different direction, right? When we become the guides, everything changes. And then I think the other piece would be that we need to know ourselves quite a bit, and that we need to keep working on ourselves and learning and knowing what are the things that are difficult for me, what are the things that can get in the way, how do I know how to take care of myself, how do I know what is mine and what is not mine, like that we continue to work on ourselves and improve
Mm-hmm.
and understand who we are, so that then that part doesn't get mixed up in the whole treatment, because it's a really integral part that we show up fully with all our experience and all our feelings, right? That we're affected by the person in front of us. It's not like we're a clean slate and we can't be affected by it, that we actually are very much affected by what the participant is feeling, and that that is part of the process. And at the same time, it's not about me meeting my needs, but
Of
I
course.
want to be able to show up fully for the participant in the best self that I can be. And I think that, and then there's less possibility of causing harm when we really actually know ourselves. I think when we cause harm is when there's aspects of us that we're projecting and we're not clear about, right? We're unaware of. So I think that that's really important, and that we have discipline and resilience, and
That's
take
key.
care of, take care of ourselves, and that we are vulnerable ourselves and can make connections and have compassion for ourselves too.
That's very good. Then, as psychedelic-assisted therapies move closer to a broader clinical adoption, so meaning I'm not saying that it's becoming mainstream, but it's bigger, the ethical responsibility becomes more important. So, what ethical principles do you believe must guide the integration of these therapies with the mainstream mental health system? So, what psychedelics need to keep to preserve when it goes mainstream to avoid being just another treatment?
Yeah. I think that we always keep in mind what are the benefits, and what are the risks, and do the benefits outweigh the risks.
Yeah.
I mean, I think that's a really important piece, and that so that we can be authentic and transparent about what the risks are. And instead of using techniques, we focus on connection, to generously really listen to um, to the people that we're treating. And so part of it is also that we have an enormous responsibility,
Yeah.
um, to keep the integrity, the vision of what this work is about, and not try to cut corners because we're trying to make it more, not take as much time, or not be, like, just that we're trying to cut corners to make the treatment more kind of concise. Like, here it is,
Yes.
it fits into this little package, right?
Yes.
So that we don't lose sight of the essence of it, right? And I think, part of this, the difficulty with this, is that we are saying it is a paradigm shift of the way that we've seen mental health, the way
Yes.
that we treat, the way that we've worked with mental health. um, and that is not easy, right? That is not easy to do that paradigm shift. It's been many, many years since there has been one in mental health, and we've approached it in a certain way. And what we're saying is there is another way. There is another way,
Mm.
and it might not be as easy and as straightforward, but there is another way that actually helps a lot of individuals.
Okay. So to keep the handcraftsmanship, so that detail, level of care, because if you go mainstream, you can become massive, and it's not, you lose the essence of it. Okay.
Yeah, and that we can offer the services to people who have generally been excluded from services.
Yes.
I think that's another huge piece. Like, this can't be just for people who can afford to pay a lot of money for a treatment. We would have not succeeded if we
Yeah.
can't find ways to actually treat the people who need it and want this service.
It's for all, for all. Okay. Now we are gonna change a little bit of subjects. You bring together clinical science, and transpersonal psychology, artistic sensibility in your work. How does your background in arts influence all the way your understanding of trauma, healing, and the therapeutic relationship? So, what's your background in art brings to what you do in daily basis?
Yeah, I think in transpersonal, having studied transpersonal psychology, for me, it's knowing that there's something bigger
Hmm.
than what is generally in front of us in the
Okay.
state of being that we normally live on, so that we can get a lot more information. So it's not excluding development,
Mm-hmm.
but also then going further than development and being able to really get information from non-ordinary states, right? That we have information coming to us from so many different areas, like nature and the universe and our spirituality and our ancestors, and so many places that give us information in psychedelic work that can inform us in addition to development and in addition to the things that we actually know and that we are used to day. So I think that that's one piece. I think for me, art is, it's taught me to focus of what's in between things, in between words, what exists in the in between. If
Mm-hmm.
you think about, a lot of times, if you think about painting, we talk about negative space. So negative space provides positive space. If we focus on the negative space, then all of a sudden, if you look at the negative space around a vase and you draw that, you end up with a vase. So it has taught me to see what is in between things, um, what is in between words, the space that exists there, and how do we explore those places that seem um, very they're very mercurial, and they're also very fast. We can avoid them, we can surpass them, right? Like we can go from one word to another word, but what if we slow it down so that we can see what's in the in between? So for me, art has helped in that way. And it has also helped that sometimes, not always, but sometimes I offer it for people to do art when there are no words, when there
Yeah,
are no words, and
a
yet,
way to express.
yes, and yet the person actually wants to share. They want to share their experience, but there are no words for that experience. And so if they're able, through color and line and form, come up with something that describes something about what they're feeling, then there's a sense of being able to share it and being able to discover more in it.
Right. Very good. No, I always believe that art is the best way for the human to express when there is no words, and can be writing, music,
Yes.
sculpture. So it's the way of expressing when you are not able to specify what are you feeling. So it's something. It happened to me once when I was in Paris visiting the Louvre, and I stopped to one. I don't remember. I remember which picture, but I don't know which one, the name
Mm.
or anything. I remember in which place it was, and I stopped, and for I stayed there for 10 minutes just admiring it, and I was like, wow, I catch in my feeling, I catch what he was saying, the artist, but it is, I thought or I felt a connection, so I love that.
Ah,
Now,
that is,
now let's go from the back and to the future. So the question has two parts. Let's look 10 years back. What would you tell your own person that, so imagine yourself 10 years back, so in 2016.
mhm.
What would you tell that is going to happen in the future, and if your best expectations would realize or not?
Yeah. I think mm, I would tell myself that maybe that there would be a possibility that the world was not ready for that paradigm shift,
Okay.
that there would be fear, that maybe this belief that if something was really working and we were getting really good results, that it doesn't necessarily mean that we're going to succeed because we're getting good results. I think I didn't know that, and I wasn't prepared
Okay.
for for it not to be approved. That I felt that there were I had witnessed so much um, healing and possibility and changing in people's lives, such in such amazing and beautiful ways. Even when it wasn't even when people still had PTSD, that there was a sense of a relief on some sort. And so I thought, well, that just means that, of course, we're going to be able to do this. And that wasn't the case. So I would tell myself that that doesn't necessarily mean that.
And now, what's your vision of the landscape, mental health landscape, 10 years from now? That's a tricky one.
Yes, because I still want to dream into that possibility. And that maybe it's going to look a little bit different, but I do believe it will happen. It's already happening. You know, I live in Colorado, and I can do psilocybin in Colorado, and we can do ketamine, and we're going to be able to do probably some other substances, some other plant medicines, and then other states. You know, now it's New Mexico, and then we have Oregon, and there's other countries that are able to use MDMA that I've worked with them, and in Australia and Switzerland, so that it's just looking a little bit different, but it is continuing to grow, and we're continuing to advance and learn from it and understand it. So it's not for naught, right? Like, it's not like it was never, I never thought of it as a waste of time by any means. I think it just improves, and we can continue to learn and continue to be able to offer this treatment to the people who really want it. And I guess my caution for the future is that we don't change it in ways that are not going to be as effective because of some other agenda, right? That we keep the priorities, that we keep the focus on what is the priority, that it is in people's healing, and can we not cut corners, right? So that we don't that you can't speed up relationship. Yes. Right. We can't speed it up. It's just not possible and not going to happen. And can we take the time that is needed so that we can actually keep the integrity of the work that we've already explored and that already has gotten some good results?
I have a thought in my mind always is dream huge, achieve big. So it's dream bigger, and then you will achieve maybe not yet, but you will achieve big. Yes. So this is we are getting to the end. Marcela, thank you very much for sharing your experience, wisdom, and care with us. Your work reminds us that psychedelic assisted therapy is not only about molecules, protocols, or numbers. It's more about the relationship, the trust, the courage to meet a human that is suffering and helping with compassion and responsibility. So any final thoughts that you would like to share?
What are my final thoughts? That to keep the belief, and to keep exploring, to keep learning, and to keep exploring psychedelics.
That's great. So at Eywa, we are very grateful for voices like yours to help us guide in this field towards a future that both is scientifically rigorous and is deeply human. So thank you, everyone, for joining us today. And thank you again, Marcela, for being here with us.
Thank you.